Parents, have you ever felt like something was affecting your child's health or development, but traditional medical tests showed that everything was normal? As a parent, you know when something isn't right, yet test after test comes back negative, leaving you frustrated and searching for answers. What if I told you there was a breakthrough technology that can actually measure what's happening in your child's nervous system, the master control center that influences everything from sleep to digestion to behavior and development? This video is for parents who are tired of hearing everything looks normal when they know something isn't right, and for those seeking concrete answers about their child's health challenges through advanced, non-invasive testing. We're going to dive deep in this quick video covering the 3 Insight scans we do here in the office. The Insight scans are a remarkable technology that measure nervous system function in ways traditional medicine and medical tests just can't. You'll discover how these scans can reveal the root cause of various health challenges and guide personalized care plans for you or your child. I'm going to share a quick sidebar about Crystal. Her story perfectly illustrates the power of these Insight scans. She was a first-time mom back in 2020, and as a parent in 2020, my second daughter was born in 2020, so it was a stressful time to be a parent, maybe more stressful than some other years for sure. But as a first-time mom, she felt overwhelmed and she was constantly on edge. And with a child requiring around-the-clock care, she found herself stuck in survival mode, battling extreme fatigue. Now, traditional tests offered no answers for Crystal, but when she saw her Insight scans, everything clicked. For the first time, she could see how life's stressors were affecting her nervous system. The scans validated her experience and provided a clear path forward. What I loved about the Insight scans she shares is that they were tailored specifically to me and looked deeper at the root cause of what was happening. And that's exactly why we do those scans. It allows us to get to the root cause of nervous system dysfunction, dysregulation, and allows us to create a clear path forward tailored to you or your child. So we're going to jump into these 3 scans here briefly to give you all a taste of what we look at here in the office and show you how we use them. So understanding each of these scans is essential to give you the full picture of the Insight technology. And the first scan I'm going to break down is called our neurothermal scan. Okay, so here is that neurothermal scan that I was talking about. And what it actually measures is the regional effects of what is called subluxation or stress on that nervous system and dysautonomia, an imbalance in the autonomic nervous system. Now, this is particularly helpful in children with or adults with digestive issues, immune challenges, and sleep disorders. And these scans can be performed on everyone from a 1-day-old all the way up to our oldest adults. It helps explain why children struggle with things like colic, reflux, and even chronic ear infections, which I've dealt with myself when I was a child. What I'm looking at on these scans is areas of color. Those areas of color, the reds, the blues, the greens jump out pretty obviously. White is in the normal range. So green, then blue, then red are increasing levels of severity. So areas of color, areas of clusters, like we see here with the red and the white, and we see it here as well, and then here again, and then also areas of crossover. These areas, when it transitions from the right to the left or the left to the right, these give us really good diagnostic indicators of where that stress is, right? That dysautonomia might be coming from these areas because we see extra stress, dysfunction on the nervous system, and then connecting those dots back to whatever challenges we are finding in that child, that mom, that dad's case history. This neurothermal scan gives us a ton of good information. Now I'm going to switch over here to the next scan, the EMG. Okay, so here is the next scan, the EMG. It stands for electromyography. It's actually a surface EMG, and we use this on kiddos about as young as 3 and up, as long as they can sit still for a couple of minutes. It gives us such good information. Now, this one is essential for understanding neurodevelopmental challenges. It reveals patterns that we call the raging bull, which are linked to hyperactivity and anxiety, and the drunken bull, which affects coordination and focus. And in cases with kiddos who might have autism, we actually see some of the raging bull and drunken bull tendencies show up on the EMG. Now, it shows us exactly where the tension patterns are that might be disrupting your child's nervous system, and it helps explain challenges with sensory processing, emotional regulation, and motor development, all things that we see very commonly here in the office. Now, as you probably could guess on these scans, the areas of red, the green, the red, and the black all through here are way, way, way more tension than we'd like to see. And then areas of yellow, like we're seeing right there in the middle, are actually underactive. So when we're looking at this, we very often hear kiddos who have plateaued in things like PT, OT, speech. They have kind of hit a plateau, and mom and dad are now looking, how can we augment that? What can we do differently to help get more out of those therapies? And they come to us and we do the scans and we see all this red tension in the upper neck, and maybe even from physical therapy, they've been told that they have low tone. I'm sure a lot of our parents have heard that before. When we hear that, I get suspicious as to what's happening in the neck. So these scans really help take the guesswork out of it, because when we have that much tone and tension in the neck and the upper part of the back, we're going to have low tone everywhere else. But it's not that low tone is the initial root cause problem. The root cause is actually we have so much tone, tension, energy up here that's what's being prioritized in the body. And this is actually increasing things like emotional dysregulation, sensory processing challenges, ADHD type challenges. Those types of things become much more significant when we see that much red and that much tension on the EMG. So super important scan for us here in the office. Gives us a lot of very valuable information, and again allows us to look at your child's health, your nervous system through this perspective of root cause neurological function to make sure everything is regulated and there's not extra stress and tension like we're seeing on this and like we just saw on that thermal scan. So that brings us to our last and final of the 3 insight scans, which is the HRV. Here that HRV is. Now this stands for heart rate variability, and like I said, it's the 3rd scan that we do, and again, this is one that we do from 1 day old all the way up. So if you're following along, the neurothermal and the HRV can be done at any age. The EMG can be done at any age. It just kind of depends on if they'll sit still enough for it. We tend to do it starting at about 3, sometimes a little bit earlier. But all these scans are safe for our kiddos and our adults and our pregnant women. So this is the HRV, and this measures your child's ability to adapt to stress. It shows us if their nervous system is stuck in that fight or flight mode, that sympathetic dominance, right? That's a big part of dysautonomia. And it helps us understand sleep issues, anxiety, and behavioral challenges. So with this scan, we can actually provide clear evidence of improvement as we're progressing through care, right? We're not just doing these scans on the first visit, we're actually doing these scans at regular intervals throughout the care plan so that we understand and we know what's going on with the nervous system, and we can actually make sure that we are seeing true foundational neurologic healing. Now with this scan, let's give you a brief overview. We're looking at 2 different parts of it. We're looking at how shifted it is to the left or the right, right? So ideally, we'd want that to be right up here on the midline and up high in the green. So this white dot is what we're looking at. And on this particular scan, it is shifted way over to the left. Now this is on that sympathetic dominant, that fight or flight mode. So this will be an exhausted, overstressed mom, an anxious teen, a kiddo that might have ADHD type challenges, someone, a brand new baby who's not sleeping well, with some birth trauma in their history. This is all going to shift our heart rate variability score over to the left this more sympathetic dominant mode. So really important scan for showing us that foundational nervous system balance, that autonomic system balance, and the vagus nerve activation, right? Because if this is shifted way over to the left, that sympathetic fight or flight primal response is doing its job, but what's not doing its job? The vagus nerve. The vagus nerve is designed to pull us back to midline and to allow us to be balanced in this nervous system. And when it is not doing its job, which is such a common thing with our stressed out kids and stressed out moms right now, we will see this white dot, that HRV reading, shift over to that sympathetic dominant side. We want to activate that vagus nerve, and that's exactly what we do in this office with very gentle, specific chiropractic adjustments, is we are restoring balance to this autonomic nervous system, activating the vagus nerve, and over time, allowing this to go from that sympathetic dominant over here to the midline, and then climb back up into the green zone, right? So I talked about that left to right shift. That's one component of this. The other component is how high in the green we are or how low we are down through here. So if we think of our body as a battery, or your child's body as a battery, the more adaptable, more charged, more restored they are, they're going to be up in this green zone. The more stressed, less adaptable, more challenged they are, right? Immune challenges, sleep challenges, daily challenges with focus and energy and all that stuff, that'll all weigh in and deplete us. So we'll see kiddos and moms, dads fall down into the yellow, the orange, or the red. So our goal with this scan is twofold. It's to get it balanced on the midline and get it up as high as we can in the green zone. So activating and focusing on that vagus nerve function, and then allowing your body, your child's body over time to rebuild and restore a healthy functioning nervous system will get us to where we want to go with this HRV. I love this scan. I actually like all three of them quite a bit. The HRV is a great one because it gives us a global look at that vagus nerve function and your body's foundational nervous system. So super, super important scan. I love nerding out on the HRV. All right, those are the 3 insight scans that we use here in the office. And just like Crystal, who now describes herself as the peace in other people's storms, your family can experience the transformation that comes from understanding and addressing nervous system function. While life's challenges don't magically disappear, insight scans help us create a precise roadmap for your child's care, leading to better adaptation, improved function, and lasting results. If you're ready to discover what's really going on with your child's nervous system, here at the Pediatric Chiropractic Center, we use these comprehensive insight scan evaluations as part of our new patient experience. These scans are completely non-invasive. They take just a few minutes for us to perform here in the office, and they provide invaluable information about your child's nervous system function. Click the link in our bio or comment below to schedule your child's insight scan assessment. Your answers are waiting. Take the first step today.